Righty, but welcome everybody. I'm Jen Barnhill. I am a columnist with military.com and a military family member myself. And I'm excited to talk with you guys today about healthcare, in particular healthcare as it relates to our kiddos. I'm joined by Kara Oakley of the Tricare for Kids Coalition, and she's going to start by giving a better introduction than I'm doing of who she is and what her organization does, and then we'll get on into the conversation. Kara?
Thank you, Jen. Hi, everybody. Kara Oakley here. I help found and chair the Tricare for Kids Coalition, and we are a volunteer stakeholder group made up of representatives of a variety of organizations that come together around military kids' health and well-being. So we have members that are in the child health advocacy space. That's how I came into this. I've represented children's hospitals for 20-something years. With respect to military kids and families that they serve. And then we have also the MSO, VSO community. So we have Military Officers Association, National Military Family Association, Exceptional Families of the Military, and I see some familiar faces there here tonight. We band together, bringing all of our different perspectives and our reach, and kind of use it for those our concentric circles to that point we get to, which is military kids' health and well-being. And so we came together a little over 10 years ago around the seminal piece of legislation for kids and military families, kids' health and military families, which was called Tricare for Kids. I wrote it. It was everything I wanted it to be, except for it didn't spend money to fix anything. It basically was a review of all the pediatric policies and practices at DoD. And the idea was to identify gaps and opportunities for improvement. And so that's basically what we started. It ended up being a couple of different reports, and I'm never sure the final report that they were supposed to do ever actually happened. But at any rate, it got the ball rolling, and we created our coalition around it. And our purpose is to kind of hold the feet to the fire on the issues that have already been identified, and until we fix them, and then to also continue to identify new issues and fix them. Some of the issues that we've worked on came out of left field. At the time we created this legislation, I had no idea, and neither did anyone else in the group, but military children were not having access to hospice care, concurrent hospice care at their end of life. That was something that was brought to me by one of my hospitals when they were trying to help a child and family and found out that they couldn't do it. Boy, we jumped on that and got that fixed within a couple of years of hard work in the halls of Congress, and then trying to implement it at DHA. That's just one example of how something rose to the top. But there's so many other things that we have identified from the beginning, the kind of things like a pediatric medical necessity standard, so that maybe if we had that, you don't have to fight so hard to get approvals for a certain kind of care, especially what we call our frequent flyers, or those who have atypical care needs. If your kid breaks an arm and go to the ER or the urgent care, once you're probably getting pretty much what exactly you need at that moment and what have you. But how are we making sure we take care of the most vulnerable? The ones with chronic conditions, complex medical conditions, the ones who need rare or orphan drugs, medications, to fit their needs. And they don't just take a pill and break it into 27 pieces and try to take it. They may have to have it compounded without dyes or other, sweeteners or kind of things. So how do we take care of all these kids that don't just fit neatly into the Tricare categories? Tricare is based on Medicare, which is a healthcare plan for senior adults. So there are many gaps that we've identified through the years and many opportunities for improvement. And that's where we fit in. We're advocates. We're not really case man, we're not really, but we don't track down things and are able to fix things one at a time as part of what we do as advocates. But what we do have are great memberships, great organizations that we can help. So if folks can bring their issues to us, we can usually at least put you in touch with someone who can help bird dog a situation. But our goal is to fix it so that it works for everyone.
Thank you so much, Kara. And I encourage you guys to ask any questions of Kara or myself directly or in the chat. And Kara, if you don't mind, we're going to share contact information. You should have both of our contact information just from the reminder email. But that way, in case you don't want to share in a public forum, you're welcome to reach out separately should you wish to. So I just ended the poll here, and I did a couple polls just asking about, how many kids you have and if your children are medically complex. And you alluded to that, Kara, and I'm interested to hear how each different group kind of identifies what problems have you identified, or alternatively, hopefully solutions have you identified, or good examples of getting good service in some location, but maybe not in another. And even if you have more than one child, how do those experiences compare? So I really would love to just get the conversation going and ask everyone if anyone's willing to share, what brought you to this conversation today? What was something that is on your mind about this topic, or something you want in particular to discuss? I will be adding poll questions throughout, but I want you all to lead the conversation. Does anyone have anything they'd like to share to get started? And as I said in the morning session, I'm willing to be let awkward silence reign. So thanks, Michelle, for coming off mute. Feel free to jump on in.
Hi, thank you for letting me join this meeting today. My name is Michelle Paulus, and I am coming to you from San Diego, California. I am actually working with the Marine Corps right now. So I work with their EFMP program, and I'm their TEO, training, education and outreach specialist for them. So I'm really here I'm also a veteran. I'm a Navy veteran. My husband's a Navy veteran as well. So he served for 23 years and he took us everywhere he went. My youngest daughter has epilepsy. And so that's what really drew me. It's my passion to be working with kids in this environment and to see what I can do to help. So I'm really here to find resources and to hear the needs of parents, and what kind of training and what kind of resources that, we can help with, that I can help with, that I can research, just to kind of gauge what's out there right now.
Well, that's great. And we had an earlier conversation this morning that, because people's schedules are in the military, people are OCONUS, CONUS. And so I'm going to summarize both of those conversations, Michelle. So hopefully you'll gain even additional insights from that morning conversation in addition to what we shared today. Does anyone else have any other perspectives to share? And I encourage you to share from both your personal perspective and if you are a member of an organization, from your organizational perspective. Like you're sharing, Michelle, I think that it's important to hear from all sides and everyone's coming at this from a different lens. Anyone else like to share? Before we ask some official. Hi, Amanda. I see you're off mute, but you have amazing filter on.
Right? I'm sorry about that.
No, it's fine. If you want. Oh, there you go.
I'm not really prepared for camera. So my name is Amanda Larimore. I'm a key spouse with the Air Force, with the 305th. We're at Fort Eisenhower, which is the greatest GSU on like OCONUS, or not OCONUS, but like on the continent. So we are kind of in a unique position. We're an EFMP family. We're on a Army installation and are servicing Air Force bases at Shaw, 2.5 hours away. We have limited EFMP support here from an Air Force perspective. Our commanders and leadership are working hard to change that, but it has been kind of a passion project since we got here. My son is diagnosed with autism. He's what they consider high functioning. So we're in that gray zone where he falls kind of, he's able to participate in mainstream classes, but he is still very autistic. When he has those meltdowns, you have the reminder. So I think biggest concerns from my perspective is that the autism demonstration and the work that needs to be done there. The parent stress index, I've done a fair amount of research on, and they're working to eliminate that, but the parent stress, the PSI, is a huge barrier, an inappropriate barrier, in my opinion, to the level of care. No other diagnoses require that. to be done, and it really was not built for military families. So it takes into account your child's diagnosis and your stress level, but doesn't account for TDYs, deployments, any stressors that the military families face. And the questions are written in a very offensive way. Like, intimate details between you and your partner. There are questions regarding, I don't know how familiar y'all are with it, but it's something worth looking into. And the other thing is EFMP, right? We don't have a lot of support where they're working on it, which is great, but the big changes through respite care are hugely affecting our family because we are in that gray zone where my husband works a lot and he loves his job, but that doesn't bode well when we move every couple of years. And I'm rebuilding a support system because he can't stay with just any sitter. And he works best with his family members. And so us being able to find somebody who can take both my kids and work through that, those changes are just becoming very difficult. And especially when we move every so often, it also looks like us filling out a lot of paperwork, right? And you don't even know if where you're gonna fall within that rubric. So that's kind of our family story, and some issues that we are working on. So
Thank you. I'm sure Kara has something in response.
I do. I want to share something and also ask something. Is that okay? I'm really interested in your perspective on this. First of all, are you familiar with the NASM study, the National Academy of Science, Engineering, Medicine? That study is going, and it's an independent analysis of the autism care. We'll send you some links. I mean, they'll be in the summary. We've already put them in a chat in the earlier one. So, but it's important for everyone to know that as of last year's National Defense Authorization Act, the autism care demonstration was sent to have an independent analysis, and that is currently taking place. And they've just had some public hearings last week. The Parent Stress Index was right up front and center, as were many other aspects of it. I believe you might even be able to go back and listen to the recorded. Do you think so, Austin? I think so. So I think it might be worth your while, especially if you're involved in sort of your resources there, in trying to improve some things around your duty station, because we can't do any of this without so many volunteers. The number of volunteer hours that the military pulls from its spouses is incredible. But I mentioned that because I do think that this is, it may not be the end all be all, but I'm really encouraged about how it's going to expose what's going on in the autism care demonstration and whether and how it really is aligning with best practices and other commercial and other payers type treatment of autism. Is that a fair way to say it for those who are, and I know, well, Jennifer can get to that too, but I want to ask a non-ACD question of you, Amanda, and that is, we hear so much about when you are in the combined spaces. So you're Army, did you say, and yet you've got an Air Force?
Flipped. So my husband's
I had it backwards.
Is cyber, and so that puts us a lot with a lot of different services. And so we've spent actually most of our career, or his career, but me alongside with him at Army installations. So
actually, okay.
So,
but you have to travel then 2 hours to get to your EFMP home. Is that what I heard?
So our EFMP coordinator, Mr. Brown, is at Shaw Air Force Base. There are currently 1,500 airmen here. That's not including their families at Fort Eisenhower.
Yeah, exactly.
So it's a pretty large amount of families here, and they are sending EFMP families here. So it's a lot of resources to pull from the Army side, because nobody's overstaffed, right? So being able to provide our own resources, because we take our, a little bit different view on things, I feel so would be helpful.
And I just feel like we hear more and more, and we certainly did for a while. And I'm wondering if this is happening again with so many folks in your situation where you're stationed away from your home service, and you don't always have the best coordination and communication, and it's not seamless across services. I don't have a specific. I just wanted to kind of make sure I understood that correctly, and I believe that's correct. Is what you're saying? It's not seamless because you're not right there with your service. Okay.
Yes.
Sorry, this helps us sort of figure out what our strategies are and things going forward and what to focus on.
And I didn't say this earlier, but the reason I host these conversations is it really helps inform my reporting on this topic. And so I have two related questions to this thread. One is, have you seen a lot in the military reporting space or in the civilian reporting space covering this topic as far as ACD? Has there been much talking about the Parent Stress Index? And I know that there has been from within the advocacy community. I've seen posts from one of the organizations represented here, EFM. I've seen posts about that, but I haven't, and maybe I could have missed that, but have you seen a lot of coverage? And feel free to put it in the chat if you, or share if anyone's heard any coverage on that.
I have not.
Okay.
I did, however, I used the EFM survey on the autism demonstration a lot when I'm speaking to leadership, and I actually passed that around to all of our commanders yesterday at a meeting, just kind of giving them a bird's eye view of what our families who are involved in the autism demonstration are going through. So I think it was a little bit of an eye-opener for those who aren't necessarily involved.
And
I would Sorry.
No,
I
go
would
ahead.
say as far as coverage, when it came to the parent stress assessments, really the only like coverage I would say that came through was when, you know, journalists or people would reach out about the autism care demonstration. I have a son who's enrolled in the autism care demonstration, and he was enrolled, my two kids were enrolled in 2017 without me knowing that they're being enrolled into essentially a pilot study. So we went from 2017 to 2021 without knowing that this wasn't a basic medical benefit. So like I would get contacted maybe in regards to the ACD, and then I would bring up the parent stress assessments, and it would get like maybe a little bit of coverage, but nothing like the changes as a whole, if that makes sense.
Okay. And I know that there are some experts on this call, and I'm sure I can connect with you so we don't go down a rabbit hole of my curiosities with the ACD. But I think does anyone else have any experiences related to the parent stress index and or the ACD that they would like to share? If not, that's totally fine, but I'd love to hear. Yes, Jen.
So I've taken like 5 parent stress assessments over the past couple of years. I've taken 5 because you take them every 6 months. I have never received my results from anyone. I've never been able to like sit down and explain to somebody like exactly what my stress levels were, what my anxiety levels. Sorry if you hear my daughter in the background. I don't know what game she's playing, but it sounds like she is, I don't know, attacking someone. She's fine, but it's just her. But anyways, so yeah, I've taken 5. I've never received my scores. I've asked for my scores from Tricare. They wouldn't give them to me. They told me my BCBA had to give them to me. BCBA was like, well, they got sent to Tricare. They have them. And then I had Tricare call my BCBA at the time twice after I took 2 assessments and said, hey, we think she's lying. Like, no joke. Tricare called my BCBA because my BCBA called me twice in like the year span that I took 2 and said, hey, I want to forewarn you, Tricare thinks you're lying on your parent stress assessment results. So they might make you take another one. And I was like, how do they know I'm lying when they haven't? So like historically speaking from these I'll nerd out for a second, sorry. Historically speaking, these parent stress assessments are used in like court cases, child custody, forensics. It's really to see like where the child-parent relationship like is stressed and possibly anxious. There are certain measures within the parent stress assessment, because I talked to PAR, who owns the copyright for these, that they said historically families with autistic individuals who are taking this will pop high for stress and anxiety, like naturally, it's always a given, right? So there's that. But we're supposed to sit down with a psychologist and explain why we might be testing higher in certain measures, certain areas than others. So I was like, how do y'all know I'm lying when you don't have a report? You just have scores. So yeah, so that was fun when they called and said I lied with nothing to back it up. I never received a phone call. So
I know you all have had these conversations multiple times, and I know I have had peripherally had these conversations, but thank you for sharing with me to help me understand how this might fit into the overall picture of how some care works for some families, because we know that it's not just the people on this call who have the people on this call have access to the networks that are available, and they've found this call. And so therefore, I wonder what the experiences are for people who are not on this call. There was another thread that you brought up, and that it would be dealing with multiple locations, multiple branches. Does anyone else have any experiences related to that thread, where they are either moving or on a joint base, or having had to, in a rural location, having to do it a different way? Anyone have anything they'd like to share on that topic?
sorry, I really don't want to monopolize, but we're prime remote considered, and we're in Austin, which is considered, a big city. I think everybody just assumed we were going to be able to find care, and it was very hard the first 3 or 4 months. Because our EFMP, everything is at Fort Cavazos, which is like an hour away, which whatever, it's fine. But being prime remote, even though we're next to, but my husband's stationed at Army Futures Command here in Austin. And so it's really hard to have to make that trek, especially since I already have to drive to Houston to get my kids care. Like, it's hard when even we're at Army Futures Command, but they don't have an EFMP person. It's not a small organization.
Yeah, that's hard to navigate on your own. I saw Holly and Ashley unmuted. Ashley, would you like to share first, and then we'll get to you, Austin, for sure.
What I have to say isn't like super important, but just to Amanda, I understand your frustration, because we are Air Force also that have been stationed at multiple Army bases. And yeah, it can be super frustrating when you don't have that help right there. For questions or whatever. I guess we were lucky because we were at Bragg, I guess Fort Liberty now, and Pope still had their EFMP office when we were there. But yeah, we've been to Fort Myer, we've been to Fort Leavenworth. Yeah, it's just super frustrating. That's all.
Thank you. I'm going to go to Holly and then Austin.
So this happened in 2015, but it was way before we even knew about EFMP. My son was diagnosed at NES Pensacola. We were Air Force, and we were immediately told that we had to enroll into EFMP and ECHO. So we started the process, and had a difficult time because it was over the summer. So we still had to get some paperwork filled out from the school. But we finally, within a month, got it all done, and we go to the naval station to drop off our paperwork. And the EFMP coordinator for the Navy was giving us a hard time and never told us for at least 2 months that we can't help you, you're Air Force. So we finally called Hurlburt, which was our Air Force base, and within a matter of 5 minutes, we were enrolled in EFMP. So I guess for the new families that get enrolled in EFMP, they're not told right away if you're at a different base or if you're at a different branch, you have to go through your service's EFMP program.
Thank you for sharing. Austin?
So one thing, I know that standardization is coming maybe in like 5 to 10 years. But I know when we went to Los Angeles Air Force Base is literally in Los Angeles where we were going to. But Fort Irwin, which is in the middle of nowhere, is who determined whether medical care was available. And so when we got to the location at LA Air Force Base, we asked them to help us find care. they were telling us care is not available, while Fort Irwin was telling us it was, and it's because one is Air Force and one is Army. And then we had to update EFMP packets from across the country while we were in the hospital in Boston, and that had to be done by Fort Irwin, and it had to be done by the primary care doctors that were there, even though they weren't actually seeing the child as a patient. And we followed up on that. That's still Army policy. So it's not changed since then. And I would hazard a guess that anybody else's kiddo who has a catastrophic accident or illness like ours did is probably going to be going through the same thing. We probably just don't hear about it because life is really overwhelming in those moments.
Thank you for sharing. Sorry to hear that. Okay. I just launched another topic, but before we jump into that, does anyone have anything else to share that they unrelated to those veins of questions? You're welcome to pop off if there's something that has come up that you wanted to share. If not, I was just wanting to find out, it looks like folks are not necessarily having an extreme positive or negative experience accessing medications. I know that that has been something on the radar of Tricare for Kids. And Kara, I don't know if you have any specific questions related to that for the group, but feel free to pose those if you do.
Just a couple of things we're trying to track is how many families are giving up on getting their medication through the mail order, the Express Scripts, or and have gone and paid for it themselves. How many of them can't find the meds that they used to get on base that aren't being stocked on base anymore? And then this is another date that's coming up that we're really watching for is all the changes that have taken place in the last year. Kind of went into effect this time last year, I think, or November or so last year. Well, then in March of this year, there's another date, and that's where the mail order Express Scripts has a specialty pharmacy owned by Express Scripts called Accredo. And then so they're going to now be channeling more of requirements to use Accredo specialty pharmacy for any specialty meds. So I'm also trying to get ahead of that change and see what's going to happen, because we hear anecdotally, just like in the civilian world, I will say on this one, that there are issues with mail order, not arriving on time, not temperature control, things like that. Or this is another one, we know kids have a lot of different needs. So a monthly prescription is maybe sometimes by the mail order companies treated not like every 28 days, but like, every, first of the month. And there might be 31 days in 1 month. And that's not always acceptable for a kid's medication regimen. And so we're just looking for what are these things that are happening? There's actually a Government Accountability Office study of what's happening so far with the network, on Pharmacy Network. And I am being interviewed by them, I think, tomorrow. So I want to, I've just been collecting information wherever I can about this, but it's never too late to turn to turn feedback in. We'll always have a chance, but we want to really make a strong showing with this GAO report so that we can continue to work toward more solutions. So just looking for anything in that category.
Based on the poll question, it sounds like there are some people who do use Express Scripts and some who do not. I would love to hear from both, either of your positive experiences or negative experiences receiving it. And alternatively, if those who are not using Express Scripts who indicated that they go to a local pharmacy, can you speak to why that might be? Or if you would ever consider moving, how would that impact you? How would this change that Kara mentioned impact your experience? Ashley, I see you're off mute. Would you like to share?
So my husband, who's the active duty member, uses Express Scripts with no problem. He's been deployed, he gets his medication, no issues. My daughter, however, we've tried it a couple of times. When she was younger, her medication dosages would be changed every couple of months. And so it was just a nightmare. So we stopped, we kind of went back to the pharmacy, then we moved again. She went off to college. We tried Express Scripts again. And we never got her medication. And they were calling me saying, you haven't paid your, $9 copay. Why not? I'm like, because we never got the medication. And they said, well, yes, you did. And I'm like, no, I didn't. Anyway, long story short, we fought about this for about 3 months. I finally paid for it. And about 3 months later, they called back and said, oh, yeah, we just got it returned to us. You never got your medication. So yeah, we stopped using Express Scripts again. And luckily, even though hers are all monthly, prescriptions and maintenance prescriptions, they don't view them as maintenance prescriptions. So they let us go to the retail pharmacy. She was in college. She is now back with us. I got a whole lot to say about Tricare in adult if anyone wants to listen to that. But yeah, so now we're back in the MTF pharmacy. But yeah, it's been a nightmare.
Thank you for sharing. Jennifer? I'm sorry, Kara, do you have anything to respond to Ashley? Do you want to?
Just real quick, the Tricare young adult, I do, just on that. I mean, I really actually think that's a really big deal and becoming a bigger deal. It's not a sustainable program. It's not actuarially sound. And every other kid in America can stay on their parents' plan until they're 26. And I've about decided we need to just go hard on this one.
Well,
I mean, we've supported efforts in the past, but it costs money. And it's hard to spend that money. But I don't know why, but I mean, I think that keeps moving up on my priority list. So just to say, it's not a sustainable program. It doesn't work. It's completely out of whack with the rest of the country, your peers, civilian peers, and I'm with you. So that's all.
Thank you both. Jennifer?
Sorry, but if you really want to see me get worked up, and Austin can confirm this, talk to me about the pharmacy changes, in the past couple of years. Because we were affected, our family was affected pretty hard, mainly because my daughter has high risk asthma and lung issues and everything going on and stuff. And so for the whole pharmacy, every couple months, the Express Scripts stops allowing Walgreens to get my daughter's inhalers filled. And it's just, now I think I officially have to go to Express Scripts. What I've been trying to just use, well, since again, we're prime remote, we have to use Walgreens. We don't have an MTF pharmacy near us. But the problem is that sometimes my daughter's inhalers get adjusted depending on what is going on, how bad her breathing is, how low is her oxygen, all that stuff. And sometimes we're using inhalers more, sometimes we're using them less. And so it's been really difficult dealing with Express Scripts and Tricare in general. When the pharmacy cuts happened with the pharmacies, I know we were using my one son, I was legitimately next to his recovery bed from surgery. He had double femur, corrective surgery, and he had gotten the plates and everything out. And I had told the hospital, Children's Mercy in Kansas City, I told them, I go, hey, we can't get them filled here. They're going to have to go to Walgreens. So please make sure they get sent to Walgreens with enough time. So that way he's not in pain when I get home and I can just pick him up and go home. It got completely screwed up. They got sent to the children's pharmacy, of course, because that's what they're so used to doing. And we were in the recovery room and the nurse called Walgreens, and Walgreens made the nurse call the surgeon who was already in the surgery theater with another surgery, and they had to call the resident and the PA because the scripts had gotten completely jacked up somehow. And I actually ended up paying for one out of pocket in the hospital pharmacy because it was just so hectic. But it's something you don't want to do. It's one thing if I'm an adult, I can process my emotions, but my kid can't process pain very well, and he's autistic, he all these other things going on, and just to have to go through that, it was really I'm very bitter, if you can't tell, with all the pharmacy issues that I constantly feel like I'm going up and down with all this stuff. So yeah, it's been a pain.
They were, I did it.
Oh, Carrie, you're muted. I think you got muted for accidentally.
Backwards, sorry. We were working so hard at that hospital to keep that pharmacy in network. And it's just not even understood all down the lines, but for better or worse, about who's because they do what the reason they have the hospital, so they can give the patient right there the medication before they leave, and things like that. And they were working so hard to stay in network. The last thing I heard from them is that because they're members of the pharmacy group, they have the okay. They were supposed to be okay as a network pharmacy, but because they're also connected with another, the pharmacy business model is so
Yeah.
convoluted that Tricare will only look at that relationship and will not do this contract with this. And it's one of these things that you're like, if everybody wants this to work, why can't you make it work?
Well,
But the whole reason these specialty pharmacies want to be able to exist the way they do is because they don't want you going home and waiting 2 days to get the medication they send you home with or what have you.
so
Yeah.
right. It's a huge fear of mine. I've worked in skilled nursing facilities before. So I've seen like how a couple hours with pain meds, all these things from like older people going to skilled nursing facilities and stuff from the hospital. So I've seen it. And that was a huge fear of mine with my son because the year before he had the surgery. And I don't think like sometimes they don't realize when they're making these decisions or these cuts, like how amazing it is, because when my son had his first surgery on his legs, the pharmacist came to his room and laid everything out on the bed and was like, this is going to be at this time. This is going to be this much at this time. And I think that they just don't understand how anxiety and like reducing that is for parents when their kids in that much pain and having these big surgeries and stuff. And I mean, I consider his surgery minor too, kind of. So I can't imagine if it's like a bigger surgery than that. So yeah, I've had a lot of issues with Tricare pharmacy stuff.
It is definitely it's a concern on many levels. One thing I would like to touch on in this topic, but it could be related to another topic as well, is for those of you who have maybe more than one child, one being maybe more, that has the higher level of need than another. Are you experiencing similar issues with either like Tricare appointments, billing, continuity of care? Are they the same problem? Are there different problems or benefits on either way? Have you ever considered that? I don't know if there's an answer, but has anyone kind of thought about that? It's okay if you haven't. That's it. Well, I wanted to be sure we get to kind of the main concern that people shared in one of the earlier poll questions was continuity of care and access to specialty appointments came up, for a few people. We know that the providers nationwide, there's a provider shortage, and that's clear. I would love to understand how the military lifestyle in particular might impact that continuity of and access. What are you hearing when you're referred? I know we shared about the wait times. Would anyone like to share any of those experiences? Amanda, go for it.
So to kind of echo Austin's issues with PCSing to stations, we initially went through the EFMP paperwork to PCS here. We were denied. We were told that there were no providers here. We're a Tricare select family. As soon as we had got the assignment notification, I started searching for providers. I had my son on wait list in January of last year. We were due to arrive at the end of June. So we certainly were trying to stay ahead of the game. It was absolutely hellish trying to get a hold of AFPC. We discovered that the physician who made the call for my family was an endocrinologist, and my son has a developmental disorder. My background is critical care nursing. I know how to navigate the system, and it does not make it any easier. I still have the same struggles everyone else has, and in no way does an endocrinologist have the ability to speak into and understand what the needs are of my son. That is not his specialty. And it's just because he has an MD or whatever his credentials are at the end. My husband spent an hour. It pulled him away from mission work, trying to unravel and get a hold of AFPC and the person who was actually making that call for our family. It was, once we got here, I had him seen by OT within 6 weeks. Took a little bit longer for some of the other specialties, but we certainly got care maybe even sooner than we would have in San Antonio. So it's been a challenge, and trying to navigate that system between providers and in the outside world, because they don't necessarily, the MTFs and those making those calls don't really have an accurate pulse on the community.
Thank you for sharing. A follow-up question to that, when you're talking about, you're not, like, an earlier conversation today talks about the provider who's seeing your child, yourself, if you're a family member, may not be credentialed in the specialty area that they're supposed to make a decision or make a recommendation in. Has anyone else experienced that before? And I know I know Austin, have already shared before. So has anyone ever experienced that? And it's okay if the answer is no. I'm just interested to hear if this is something anyone else has dealt with. It's fine. That said, does anyone else have anything else, would like to share anything about the continuity of care, accessing appointments, whether they are mental health appointments, medical appointments, like, primary care appointments, or anything like that, before we move on to another topic?
And can I add a question to that too, to say, or has anybody had any luck in making appointments before you move duty stations, in a new duty station before you move to a duty station?
Yeah, and Amanda kind of indicated that and please correct me in this clarification, that you said that you kind of got yourself on wait lists, and that's what resulted in you having the 6 weeks. Is that a correct summary of the situation? Yeah.
Yes, it was.
So you were on wait lists, which allowed you to get that more timely appointment. Okay, thank you for clarifying. Jennifer, did you want to share?
Yeah, sorry. No, we just PCS like this summer, so everything's like super fresh. So I was actually able to, because again, we're moving from MTF to civilian world. I was able to get my kids like primary care appointments within a week or two of us first move, like setting foot in Austin, which was fantastic for all of us. What I didn't anticipate was my middle son is autistic. He's severe, minimally speaking, the whole 9 yards. No one wanted to treat him besides his pediatrician. I'm begging, Dell Children's, will you, developmental peds, psychiatrists, anybody, will you guys please see my kid? No, we don't see kids that are that aggressive, or sorry, we're not taking on new patients. Same thing for local psychiatrists, like nobody wanted to see him because he was aggressive. Then also too, a lot of providers in the area, like psychiatrists and therapists and stuff, they've gone private pay. They are no longer taking insurance at all. So that was a huge issue for us as well. Thinking about that, but I called Dell Children's, Baylor Scott and White, Texas Children's, and the joke's on Texas Children's because they have to see my son regardless because he's a rare mitochondrial disease now, and that's where the specialist is. So, but and then I was even looking into traveling to Cook Children's in Fort Worth and for behavioral health, but they are in network with Tricare for medical, but not behavioral health. So couldn't go there. And basically our pediatrician was like, I'm going to have to call like an emergency meeting with our psychiatrist because he was very upset with the move. We were having a horrible time with it, but no one would see him. Even our OT and speech who saw him one time were like, we don't know if we can continue to treat him. But thankfully the OT was like, no, we cannot discharge this family. Like, that's just wrong. So, but everything's good now. And we finally did. I begged Baylor Scott and White to please see him. And they finally did. But he was almost too autistic for providers to see, which I thought was just completely asinine. So we really struggled with that when we moved. So
yeah, that can be, aside from continuity of care and the fact that like a person finds a professional that that works well with them, and then they have to move. That disruption is always a part of military life, whether you have a high level of need or, just a standard level, there's no such thing as a standard level, but you know what I'm saying.
Right.
Like it
Typical.
doesn't seem to matter. And I wouldn't even say that.
A lot of people don't realize when you move from Kansas to Texas, you're going from west to east. So it's not like, I mean, I would have driven back to Kansas if he needed, to go see some of those providers for continuity of care. I was that desperate, and I couldn't do it because I transferring
Different regions.
different regions.
I hear you. Thanks for sharing. Holly, would you?
I think it's one of the problems with one of the many problems with Tricare is it's so many layers and cumbersome, and it's reimbursement and all that. So when providers already are stretched thin, which we know they are with pediatric specialists everywhere, and especially behavioral mental health providers, and they look at their patient base and they're like, we're pretty full already, and then we take on this payer, whatever or not, and it's I guess it's just one of those ugly realities. I mean, we hate to hear it, but I will say, even in the complete civilian world, there is just a real struggle to find kids with co-conditions and certain types of the behavioral. There's just so few places that really are geared toward treating them. And so, especially in a region, for example, that's why we always push to have higher acuity care and pediatric specialists, which we know are very small in number relative, and you can't find them in every place, even in big cities. So we always want the provider directories to be searchable across regions, across 100 miles, across prime service areas and all that. We've been fighting for that for years. I have to say that's not something we've succeeded on so far. So, but I hear you.
Thank you. Holly?
So it's a question for Kara. So I know Tricare for Kids fought and actually got in the NDA the Tricare specialty providers referrals. I think my question for that one was I know what the contract I'm going to get the contract name wrong. I think it's the T5 with them, with Health Net fighting the contract and wanting to keep West. The specialty provider law isn't, and it's not happening until that wins. Or sorry, I cannot talk today.
Until it takes place, I think is what you're saying. Until it's implemented.
Yes.
That's my understanding as well. Supposedly this was supposed to be able to be done back office and specialty providers. I'd have to go back and look at some of the details too, Holly. Sorry about that. It's not fresh in my mind. But it is that, I believe that is, T5 has not yet gone into effect, and it is not slated at this point to go into effect until January 1 of next year. And that's supposedly when we'll see those changes with specialty referrals and a better system for making appointments pre-duty station move.
Is there anything we could do to, as military families, to help push that away from waiting for the T5?
Health Net did tell to me there's several things that they are working on that they can do without waiting for T5, but I think it all has to be agreed upon, and then they have to write contract. And I don't know if this is one of them. I tried to nail that down and couldn't. But it's the type of thing that I expect. That's what they were referencing, things like this, that they could do without the T5 construct, but it would require everybody getting together and writing out the contract changes for the current one and figuring out how to pay. They have a whole process for that. And while they're in a legal dispute, it's just, I don't think it's going to happen.
Yeah. Well, thank you.
So if that makes sense.
Well, thank you.
I do think that legal dispute, we may have a resolution in the next 10 days. I'm expecting something big by the end of the month.
Oh, awesome.
And that will tell us what will happen with T5.
Great. Well, thank you, Tricare for Kids, for getting that specialty provider, especially with that fear of, because we were transferring from west to east, and we had the same issue our last PCS going east to west. So it was great to hear that you guys were fighting for it and got it in. So thank you.
Thank you.
Well, I appreciate everyone being here. I wanted to make sure that everyone who wanted to share has the opportunity to share, even if it's unrelated to anything that we've discussed so far, related to this topic. I know that there are a variety of experiences because every person is unique and every child is unique. And so I don't want to aggregate everyone's experiences and summarize them in my articles and neglect the small stories too. So if anyone has anything they'd like to share, feel free to come off mute. Otherwise, I will let Kara ask any follow-up questions and be mindful of everyone's time. But anyone have any other things to share or things that they think we should be talking about? Hearing no one off mute, I'm going to just assume that we're all good and we covered a lot of things. The last question I asked, I almost didn't know if I was going to ask about EFMP enrollment. It seems about 50-50 people are enrolled or not enrolled, despite possibly being eligible. If you want to share anything about that, feel free. But I have talked about this with many in the past as to the reasons, but I want to see if Kara, do you have any other follow-up questions before we wrap up the evening? Or I see you're coming off mute. Ashley, did you want to share something?
Oh, I mean, if you want to hear my reasons, I am happy to share them because
Sure.
I admit I'm the biggest hypocrite in the world. I am the peer support director for EFM, which basically means I monitor all of the Facebook pages. And, I'm constantly telling people it's a mandatory program. If you're eligible, you should enroll, blah, 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 blah. My daughter was our EFM until she aged out of the system. And rightfully so, she has multiple medical issues, sees a ton of specialists. So, we needed to make sure we were always in a location that could meet her needs. I'm getting old. I have all kinds of health problems, and I have just neglected to enroll in EFMP because it's a pain in the ass. Especially the way that Air Force has changed things, where they want to see all of your medical records. They tell us over and over again that they did this to make it easier for Air Force families so that we didn't have to get that 2792 filled out, so that we didn't have to come in the EFMP office and have a face-to-face meeting. But what's happened now that this has been 2 years with the new program implemented is that they're wanting to see medical records. And who has to get the medical records to them? The families. So it's actually gotten a lot worse. And that's why. And I've been lucky. My husband and I he geobadged for a year. So he was cleared to come here. And we stayed behind. So I didn't have to do any travel screening. Then I came up here. He was here for 3 years. He deployed. He's now here for another 3 years and will probably retire before he ever PCSs again. And so, that's kind of why I have no intent on doing it. But I am not the only one. It is a pain. And we get questions all the time. My husband's retiring soon. We're not going to PCS anytime soon. And I'm just like, yeah, it's a pain. It's so much paperwork.
Yeah.
But anyway, I'll shut up now because
No. I think many others have shared that they just didn't see the return on investment, for a lack of a better phrase, that the hurdles that are jumped through, and yet sometimes, and even what we're talking about today, I guess this is another question, is how often are you actually being placed in a duty station location that takes your EFMP status into account?
Right.
Placing you in the location that can meet your needs as stated by the program, which is what the intention is. I obviously have, if anyone wants to share on that, they're welcome to. If not, let me know. We can also end the recording and share more if anyone wants to feel more free to chat. Kara, do you have anything else you wanted to say?
Well, I'm very concerned about access to care, and it's being harmed by several of these things that we've talked about today, and including network adequacy and some of what Jennifer just talked about, and back to what Amanda talked about earlier on, where her destination is an EFMP destination, and yet the system is taxed, if I understand correctly, loaded. And we have, for example, I know good and well in Colorado Springs, Colorado is where tons of EFMP families are. And the Tricare just cut reimbursement to that hospital by 40%. And what's going to happen when we're sending EFMP families to these places that supposedly meet their needs and the community can't absorb them because the direct care system we've lost so many pediatricians. And it's not just the doc, it's the other folks around them as well that do all this. And I just have I have really deep concerns about access to care when this is happening. And just because I know a couple of places it's happening, that probably means it's going to happen in a lot more than just those. But when you have the medical billets that have not been filled, you have empty uniform positions that aren't backfilled, and you don't have medical students in the pipeline, we're going to be more and more at the mercy of the community. The community is already strapped, right? And these are big picture issues. And I don't want to be the nervous Nelly or the sad sack. I'm an optimist at heart, but I worry about the Tricare benefit being sustainable in the current way it is if we don't do something to address these big picture issues. So those of you who have reached out to leadership and can get the word out, like with Jennifer and her stories that she's so great about sharing, the time is now.
Thank you for sharing. Anna, I saw you came off mute, but then we started on different things. Would you like to share?
Yes, I was just gonna agree. So I have moved 2 times in the Air Force's new system. I haven't yet provided medical records like Ashley said the family's supposed to. I just give them the information of where we use, what doctors we used or whatever, and they requested it. This time I'm about to PCS again, and I'm gonna do it a little different and try to get the records ahead of time because I'm anxious about this move in particular, more so than I guess I was the last couple. My son, who is just about to age out of the system in a year, has to get a steel bar removed from his chest, and it has to be done in December. And so we move in July. So I'm really Austin was helping me with figuring out what hospital to go to because we believe we're going to DC, that my husband has been offered a job at the Pentagon. So, but we don't have our assignment notification yet. So we're kind of in this waiting. And so I need to get ahead of the, because because he had the steel bar put in 2 years ago. So anyway, there was that. And I was going to say that I don't even actually know if I'm enrolled in EFMP for myself because I've never filled out a 2792. But I reported that I'm diabetic and that I have high blood pressure and things like that. So I should be. And now I see an endocrinologist, and I just had a hysterectomy. So I'm assuming that I definitely will be enrolled this time, but who knows? We just, when we fill out the form, we're just honest and say, these are the things we need. And this is they obviously have, access to we've only been seen so far. Other than our specialties, we've only been seen at the MTF for our PCMs and things like that. But that was all I was going to say. Yeah. So
thank you for sharing. If anyone else has anything else to add, I'm all ears, but if not, for anyone who has to jump off, you're welcome to do so. I'm going to end the recording, but thank you guys for coming. I really appreciate it. And again, don't hesitate to reach out to myself if you want to share something offline here, or Kara, if you have any questions about the resources that Tricare for Kids Coalition has, or any updates that we might have shared. I will be sending out a summary after each one of these different conversations. I write a post about that summarizes, and then I also use the information provided to write articles on the topics that we've discussed. There's so many that we just discussed just now, so I don't know which item will be the one that is in the article, but there's so many veins. So if I might reach out to some to follow back up just to make sure I got it all accurately and understand the complexity of the situation. But thank you all for coming. Like I said,